Good morning, ladies and gentlemen, and welcome to day 2 of IPS Tote Board Transforming the Non-Profit Sector Conference. The theme this year is Good Enough Evidence for Social Good. And the panel for today is What's Good Enough Evidence to Inform Your Programs? Yesterday we had the first panel and it was on evaluation. And we talked about what is evaluation, when do you do evaluation, what kind of evaluation should you do for what kind of programs, at what stage of the life cycle of your programs, how much should an evaluation cost? So it's we didn't arrive at any easy answers as with such things. We tried to arrive at rules of thumbs, like maybe a program should only, an evaluation should only cost about 10% of your program cost or something like that. But even then, there are lots of caveats and considerations. And so the same thing with today, I don't think we'll arrive at any easy answers. If it were, you wouldn't be at a conference discussing this. You would just read like a 2-page rule of thumb or guideline about how to do evaluation. Today's program is about evidence, the use of evidence. And so I'm very grateful, especially for Professor Hugh Davis and Howard White for being here today, because while it is the morning for us, it is an ungodly hour where they are. And for those of you bemoaning the fact that we can't do this face-to-face, there are some perks. I imagine if we were at the ballroom, there'd be people streaming in, ushers moving, and then say, excuse me, and then at a post-COVID Zoom conference, you will never forget a name because it's all there. And our admin has kindly reminded you to name yourself and your organization which you're from. You will never forget names at Zoom. And also, if this wasn't on Zoom, I think Hugh and Howard wouldn't be able to join us, I think. And so it is a great fortune to have them. So what will happen today is that Professor Hugh Davis will start by kind of giving an account of the changing landscape of evidence-based evidence-informed policy and practice for the last 20 years. This is about, what counts as evidence, who can do evidence, who can create evidence, who's supposed to absorb and consume evidence, and how should evidence be produced. And so he'll kind of set that context for us. And then Dr. Howard White from the Chief Executive Officer from Campbell Collaboration. I don't know if this is the right term to use. I think of it as an evidence-based clearinghouse, and he can correct me if I'm wrong. And he'll give an account of the evidence is there, it's being consolidated, made sense of in various of these platforms. How does one from the nonprofit sector access, make sense of, and make use of the evidence if you're thinking about creating a program? And then we'll have Mrs. Anita Loh Lim, Senior Director of Impact and Research from Touch Community Services. And she will actually share her on-the-ground experience of using the evidence and implementing it in a nonprofit here in Singapore. And we'll also have 2 discussants, Dr. Chu Chi Ming, Director of the Translational Social Research Division in the National Council of Social Service, and Ms. Helen Sim, heading the Strategic Planning and Research portion of Fei Family Service Center. So what happened is each of the speakers will talk for 20 minutes, and then we'll have the discussants reflect upon what the speakers have said, think about its implications for the local nonprofits, and then there'll be a general dialogue between the discussants and the speakers. So there's no Q&A in this part. So please reserve your questions for the breakout sessions later. Right after this part, we'll go into breakouts for about 30 minutes, and then we'll come back again for a 10-minute session with you, share what they thought was the most interesting part of the conversation today. So without further ado, I'd like to hand over the mic to Professor Hugh Davis. Over to you, Hugh.
Thank you very much, Justin. It's a pleasure to be with you and a pleasure to be with you all. It is a somewhat ungodly hour, as you say. It's 3 a.m. here in Scotland. So I've managed to prop my eyelids open, and I hope I can provide you with some useful thoughts about the evidence world and help you to think through some of the challenges that you're facing. Let me just see if I can share my slides with you. I hope they're now up. So As Justin said, I'm a recently retired professor emeritus at the University of St Andrews in Scotland, and I've been working on these issues with colleagues across different countries for well over 20 years now. And just trying to advance my slides. There we go. Okay, so what I'd like to do with you, as by way of providing some preamble to this meeting, is to explore some of the insights that we've gained over 20 years of study and exploration in this area. We're all interested in evidence-based change, but it turns out that it's a much more of a challenge than we thought it might be to get that kind of change to happen on the ground in different kinds of institutions and different kinds of organizations. And so what I want to talk about with you this morning is I'm going to work through a little bit of history, but not too much, about the evidence-based movement. I'm going to explore some of the complexities of thinking about evidence-based practice. I'm then going to share with you some insights from developments across very different sectors. So lots of different organizations are interested in using evidence. And I've been working in healthcare, social care, education, the criminal justice system, and various other organizations. And so there's much we can learn, I think, by looking across different sectors. What I want to then move on to is to talk about some of the things that have remained fairly constant over the past 20 years and some of the things that are changing perhaps rapidly, and to look at what might be some of the challenges that endure and some of the opportunities that are arising. And then lastly, to set, if you like, an agenda for some of our discussions, I want to draw attention to 3 different themes that might help us to think about making better use of evidence. And these will be for reflection and discussion. And the departure point, really, where I want to start is really going back to the 1990s. And you can tell that this is the olden days, because not only is this picture of Tony Blair here in black and white, but also he looks infeasibly young. But in the 1990s, there was an upsurge in interest in using evidence, of trying to move away from more ideologically driven approaches to services to one that took a more dispassionate look at what worked. There was a relative optimism at this time that evidence could help us to devise and implement more effective services. And there was a sort of default model that had already been around for the best part of a decade, dating back to the 1980s, of evidence-based medicine, introduced by people such as Dave Sackett and others, and elaborating a way of trying to produce decision-making that was more cognizant of the research base. And what we saw at this time was substantial investment in evidence-based policy and practice initiatives across many different sectors. This kind of way of thinking was a major plank in what you might call a new public management of the time, a way of thinking about managing public services that emphasized measurement, that emphasized evidence-informed programs, that emphasized looking at outcomes and making sure that we got good value for money. And at the same time, this was an international phenomenon. It was happening in many different countries, in the North and the South. And there was a real push to try and develop the supply side of evidence. So we saw the formation of the Cochrane collaboration and the Campbell collaborations, both attempts to synthesize and collate research-based knowledge on what works, on what kinds of interventions might make a difference. But about this time, at the turn of the millennium, it also became clear that although there was a lot of activity on the supply side of research, a lot of attempts to generate better knowledge, those people involved in that industry, those of us who were in the knowledge business, it became clear that we were making a lot of noise, but it wasn't always obvious that we were having a lot of impact. It was very clear that oftentimes public policy was not very well rooted in evidence, and that the practices of organizations of all kinds were often very variable, very diverse, and not always rooted in evidence either. So it became clear to us, myself and colleagues, that there was a real need to try to understand how to get evidence to have more of an impact than it was having currently. So I like this poster that I saw posted up in a hospital. Who would ever believe that Irish pubs banned smoking before English hospitals? So despite the evidence of the health effects of environmental tobacco smoke, it took a very, very long time before public policy caught up and before practices in places like hospitals caught up and things like smoking constraints were put in place. And what this draws attention to is that actually using evidence is a pretty tricky business. And I want to really summarize some of these challenges with this slide here, which is a kind of model of the processes by which research comes out of the research community. On the left here, the research world goes across into the practice world where changes take place. And that this is what's called often the two communities model. It posits that there are a community of researchers who are creating knowledge and validating knowledge. And there's a second community of practitioners who are sharing knowledge, adopting that knowledge, implementing solutions and so on. And that there is relatively limited overlap or communication between them, that knowledge comes out of the research world, percolates into the practice world, and sometimes there's information passes in the opposite direction with research priorities. And this is very much the default way of thinking about moving from knowing to doing. It underpins many of the ways in which people think about research pipelines, of driving research-based knowledge out from the research community and into the practice world. And it assumes a really rather uncomplicated relationship between research and knowledge, as though these two things were somehow synonymous. And also between knowledge and action, that simply knowing things is enough to prompt action. And what I would contend in a nutshell is that there are many, many problems with this way of thinking about the world. That it's very simple, it has a high degree of rationality embedded in it. It's quite linear, it's quite unidirectional, it sees knowledge passing one way from left to right. It's very much individualized. It's about people thinking differently and doing differently. It's quite asocial and it's quite acontextual, so it doesn't pay much attention to the context within which practitioners are embedded, for example. By my reckoning, this two communities model, this sort of rational linear model, as it's sometimes called, lies behind many of the difficulties. It's a default way of thinking that actually doesn't serve us as very well. And it's really a critique of this model that underpins a lot of our own thinking about how to get research-based knowledge more effectively used. And I want to elaborate a little bit on that in the next few slides. So one of the reasons why this model is problematic is because it posits a relatively singular view of what counts as evidence. And for some people, evidence is primarily about high quality research on what works, often a focus on systematic reviews and randomized controlled trials. Now, I'm a fan of systematic reviews and randomized controlled trials. They absolutely have their place. But if we overemphasize those, we blind ourselves to other forms of knowledge. And one of the challenges of thinking about evidence, if we focus on randomized controlled trials and systematic reviews and what works type evidence, there are some consequences that come from that way of thinking. So first of all, it assumes that generalizable knowledge is possible, that we can take knowledge created in one arena, in one setting, and we can transfer it into another setting, and it will still hold good. The second is that it focuses on instrumentalist knowledge, so knowledge about effective treatments or effective programs. It's about what to do. Should we do this program? Should we do that program? Should we use this treatment or should we use that treatment? It's very much about decision choices and picking from a menu the right kind of interventions to use. It also brings to the fore issues of research quality, but that research quality is assessed mainly on methodological considerations, the quality of the randomization, the quality of the blinding, the technical methodological considerations, rather than broader issues such as how relevant is this data to my current context, my current situation. So I think one of the challenges for the evidence-based movement is that the overemphasis on what works knowledge and randomized controlled trials and systematic reviews is it takes you down a particular way of thinking about the world that often doesn't correspond all that well to what practitioners experience. Because in order to get effective services, we need a much broader array of knowledge than simply what works. So, for example, we need to know about problems. We need to really properly understand in all their granularity and all their complexity, the nature, the origin, the history, and the interrelationships between health and social problems. We really need to understand the lived experience of people who have social problems on which we're trying to intervene. We need to know why solutions might work. We need to understand the components of successful practices. We need to understand how they interact with contextual matters. We need to know which subgroups they work for, under which settings and which circumstances. And we need practical know-how, pragmatic knowledge to support services and program implementation, how to do things, how to make things happen on the ground. We need to know who to involve, what sorts of skills are needed by practitioners, what is it that they bring to the table rather than simply reproducing a preset program. We need to know how to build alliances for action, how to involve new collaborations. And so these kinds of knowledge are much broader and are much more complex than simply what works type knowledge. They push us to think in much greater depth about the sort of research-based knowledge that might be helpful to us. And they're often not about decision choices. They're often not about do this or do that, but they're about thinking about and reframing and perhaps re-problematizing the way in which we've thought about the issues and challenges that we're trying to address. They also mean engaging with values, that different people will come at the same set of data from a different perspectives. And that's a political and negotiated set of problems that the data don't always speak for themselves. They must be understood and interpreted in a particular context, depending on the value set that's been brought to the table. And these different ontological and epistemological bases lead to methodological diversity and arguments and contestation about what counts as robust or rigorous evidence, because they do draw on diverse methods, qualitative and quantitative. And that diversity provokes lots of conversation and lots of challenge about the quality of the research data that are being explored. So what we see then for integrating knowledge, for having research-based information that can change practices, is that moving from research, which is essentially collated data, to valorizing it as evidence, to saying it is important and valuable and something we need to look at, or embedding it and suggesting that it forms stable knowledge, are very uncertain processes. As we move along this spectrum from research to evidence to knowledge, we have to engage with values, we have to draw upon experience, and we have to incorporate not just professional experience, but also user experience. And that these processes of thinking that enables us to interpret research data as evidence and consolidate as knowledge, these processes are very social processes and are contextually situated. They don't happen once for all time, they happen repeatedly, and we revisit them in a very situated way. And because people bring very different prior perspectives to the table, it's not necessarily true that these processes will be convergent or will be shared. They will be contested, they will be argued about, they will be debated. And in that process, as we move along this continuum from research through to evidence, through to knowledge, we may all have to do some quite difficult unlearning. We may have to jettison ways of thinking about the world or things that we thought that we knew. And that makes it for a very complex process. And it's also important to note that it's not just what knowledge or evidence, but also whose knowledge or evidence. Evidence is often in the eye of the beholder. So a powerful person in an organization is better able to assert that a certain type of research constitutes knowledge than a less powerful person in an organization. And we see evidence being used selectively and tactically to deliver change in organizations, not just used in a way to drive evidence-based change. So there are significant limits to standalone knowledge. The knowledge is contested. That contestation may be sometimes backgrounded and not immediately visible, or sometimes it may be very much to the fore. But social science-driven knowledge is inevitably contested, and we need to draw attention to that and be fully cognizant of that. So the idea that we can simply base services or policy and practice on evidence is perhaps too ambitious in its scope. But I think we can reflect on the role of evidence to inform what it is that we do. So I want to bring the story up to date, as it were. I began by talking about the 1990s and the desire to develop more infrastructures for evidence-informed policy and practice, and some of the challenges of having a simplified two communities model. And what we've seen since then is a real diversification of the way of thinking about knowledge, a complexification. And myself and colleagues over the past few years have tried to review what's been happening in various other parts, healthcare, social care, education, criminal justice, and so on, with a generally supportive view of evidence, that evidence is important and can be helpful, but not wholly uncritical either, but always with an emphasis on practical things. And the key features of this text, what works now, is that, first of all, it's cross-sectoral, as I've noticed. And second is that alongside a UK analysis, we have a number of international commentaries in comparison, so we can see how these debates are unfolding, sometimes similarly, sometimes differently in various parts of the world. Broadly pragmatic and supportive of the evidence-informed agenda, and it contains a three-part analysis on the practicalities of generating, labeling, and then using evidence that I hope colleagues in this conference might find useful. And I want to sort of bring my presentation on by really reviewing 10 key points that come out of this analysis that you might identify as both things that are continuing issues and also opportunities for change. So the first observation I would make is that evidence is still viewed as an important resource for policy and practice, but now there's a much more realistic view about the nature and extent of its influence. And by that I mean that we no longer see evidence as the final arbiter of what we must do in organisations, but we see it as a resource on which we can draw on for various strategic and practice-related conversations. Central government has continued to be the main investor in evidence provision, but alongside there's a growing role for not-for-profits initiatives and investments to try to increase the supply of research-based knowledge. And there are some ongoing and longer-term initiatives to support evidence use, but the sector as a whole is really about short and medium-term investments based around project activities, and that leads to some concerns about sustainability. Are we doing enough to generate the infrastructure and the ecosystem to support evidence use? What we can also see is that the what works question dominates evidence use. We're still stuck in an argument that is about focusing on randomized controlled trials and systematic reviews, but outside of that, there is an increased appreciation of how evidence can inform many other policy and practice questions, and an interest in diversifying the sorts of methods that we use. So there's also a continuing emphasis on methods for categorizing and labeling evidence, and we've seen a period when evidence hierarchies with systematic reviews at the top was dominant, now to a diversification of approaches to assessing evidence. So things like evidence matrices or principles around evidence, often developed by NGO and third sector organizations who are grappling with very complex problems and the need to integrate across diverse methods. There's a recognition that we need to combine research-based evidence with other forms of knowledge, so that we now know and we now recognize, for example, that service users know a lot more about the nature of the services that they receive, and that we need to incorporate their perspectives as well. The problems of evidence use are still a real challenge, but there's a greater appreciation now that getting evidence used is about much more than generate, collate and share. So we're moving away from just trying to push research-based knowledge out from researcher communities to recognize that we need to generate pull, a desire, a hunger for evidence in the sites where evidence might be used. And we also need to generate processes of what have been called linkage and exchange, bringing people together in constructive dialogue. So there's a continuing awareness of the importance of relationships then between producers and users, and there's a greater willingness to experiment with different ways of supporting these closer relationships. And building out from this then, we're starting to see an interest in building multifaceted systems for evidence use, recognizing that actually organizations don't operate in isolation, they operate in a kind of ecosystem of knowledge, where policy and practice are articulated together, and where organizations that deliver services build relationships with organizations that are heavily involved in research and data analysis. I think one of the observations I would make to round this section off is that although we're seeing an increased emphasis on using evidence to inform public discourse, service users and the public are often still at the margins of these conversations, and there's more work to be done there. So to wrap this up then, I think three themes come out of this work: themes of breadth, of plurality, and of integration. So it's about balancing and interweaving data analysis of all kinds, not just from formal research, but from routine data sets and management information systems, to interleave data from all sorts of different sources, to recognize that these data are always interpreted in the light of values and preferences, and interact with wider knowledge and experience. And we're seeing a rebalancing away from just research to recognizing that research sits in a more complex web of different types of knowledge. We're seeing plurality in terms of the number of voices that have been invited to these discussions, and rightly so. And we're seeing a view that is a more integrated view of knowing and doing. And rather than seeing these as separate processes, we carry out research to generate knowledge, and then we take that knowledge and we generate action. We see these now as more closely integrated, that we know and do at the same time. And I think all of these three themes provide us with opportunities for how to do things better. This slide I'll skip over, but it will be in your pack. It's just some examples here of more integrated knowledge use in practice, where knowing and doing are more successfully integrated, and some of the strategies that can be used from in-house research training programs to embedding and co-locating researchers in service settings. But I'll leave you to explore that in your own time, or happily return to this during the breakout session. So the point I want to end on is that there's sometimes overly simple ideas about how research gets used and is influential. There can sometimes be a desire to see research as being the important driver of service change. But actually, the sort of more nuanced and complexified understandings that I've tried to articulate can open up fresh avenues for better research. So to take home messages then would be, first of all, to be wary of sort of rational linear knowledge transfer that conceptualizes research communities and practitioner communities as somehow separate, and to think much more in terms of connected social systems with interactivity at lots of different levels. And if you're trying to promote research use, promoting that interactivity is a key aspect. I think experience has taught us that research that informs new ways of thinking may be more influential in the long run than simply studies that try to suggest that this program works or that program works. But actually, research that forces us to re-problematize and reframe what Carol Weiss would talk about as enlightenment research can be more influential in the long run. In terms of getting research used, it's very much about engaging upstream in the research process. The more that practitioners are involved in defining the research questions and shaping the research process, the more likely they are to be engaged and interested in the findings. And so we should think more about partnerships between researchers and practitioners than two communities. And lastly, we need to understand and take proper cognizance of the fact that research influence, application and use are social situated and highly contextual processes. And this understanding presents many challenges, but also presents many opportunities for doing things in more creative ways. So with that, those four take-home message, I thank you for sharing this time with me, and I look forward to the discussions that come from this. Thank you.
Thank you, Hugh. I really appreciate how you've kind of unpacked this for us. I think in Singapore, many of us still has a very orthodox view, this linear rational model of how evidence is produced, who gets to produce evidence and how it's supposed to be used by the practitioners. Next, I would like to invite Howard White. I think we'll all be curious to hear your views of being in the Campbell collaboration, whether you think that the Campbell collaboration is at the forefront of what Hughes is saying, you know, that now evidence-informed practice, because you're in the business of systematic reviews, whether Campbell is thinking along the lines that Hugh has mapped out, a complex web, not a linear rational model, or and over to you, Howard.
Okay, thank you, Justin. Thank you, Hugh. I could spend a couple of hours responding to Hugh, but I don't think I have that time. But some of what he's said, I will be talking about during my presentation. I am going to start by talking a bit about the meaning of evaluation. I understand you did speak about that yesterday, but it does allow part of the response to Hugh and part of where I'm coming from. So I'll mention very briefly the evaluation of a nutrition program in Bangladesh, which I worked on nearly 20 years ago now when I was at the World Bank. So this was a growth monitoring program in which community nutrition practitioners, local women were trained to weigh babies on a monthly basis. The mothers would take the babies to a weighing station and have the babies weighed. And the main theory of change behind this program was that the reason why you had high levels of malnutrition in Bangladesh and across South Asia was ignorant mothers, that mothers didn't know how to correctly feed their children. And so giving nutritional counseling to the mothers of these children to feed their children better nutrition practices in general, feeding colostrum on birth, exclusive breastfeeding, using green vegetables when they wean the child, and so on. Giving these nutrition messages would improve nutritional outcomes. And if we looked at what was happening to malnutrition in project areas from the monitoring data, and this project was weighing babies, had a lot of monitoring data, then we did find a fall, particularly in severe malnutrition, the bottom of the two lines, severe strong reductions in malnutrition. So I say here BINIP because BINIP is the Bangladesh Integrated Nutrition Program. That's the name of this project. So this project was on the basis of these data held up to be a great success. And this was a pilot program across 79 sub-districts in rural areas in Bangladesh. And on the basis of these data got scaled up. And there was a $1 billion credit made to the government of Bangladesh to go to scale nationally with a national nutrition program based on these data. The problem is that these monitoring data don't measure impact. They just tell you what happened. It's a factual statement rather than a counterfactual statement. Whereas impact is the difference the program made, which is a counterfactual statement about what happened compared to what would have happened in the absence of the project. And that's not measured by the change in what happened in the outcome, because outcomes change anyway, regardless of interventions. So you want to know actually what would have happened if the outcomes in the absence of the program. And just looking at the what happened to the outcome, this was very much part of new public management in the 1990s, as Hugh mentioned. And you have a lot of results frameworks, and results frameworks are around still today. And I call this the fallacy of results frameworks, because it's commonly believed that simply monitoring indicators at the impact level, so impact is longer run, higher level outcome indicators, tells you about the impact of the program in terms of the difference it's making. So there are two meanings of the word impact, and they're conflated. One is impact as an impact evaluation, what difference the intervention made, and the other is impact in the hierarchy of indicators, inputs, outputs, intermediate outcomes, final outcomes, impact. And there are two different meanings. and you shouldn't compare the two. You've got an impact, you've got a results framework, impact indicators. Changing those impact indicators tells you nothing about the impact of that program in terms of a difference that it's made. So we need to actually to do evaluation to tell us what difference the program made, do effectiveness studies or impact evaluations where we compare the outcomes in the project areas in the project group with outcomes in a similar comparison group, preferably randomized controlled trials. So in the case of BINIP, this graph shows again the trends in project areas, and it shows the national trends in malnutrition. And you see that BINIP did know better. It actually mirrored very closely the national trends, and then it started to actually underperform the national trends. So the falls in malnutrition were seen in the BINIP project areas were actually nothing to do with the project. In our study, we used a mixed method approach, and I'm a big proponent of mixed method evaluations and mixed method systematic reviews. And this was based on a theory of change type of based evaluation, which was quite unusual in those days, and showed that, I can't go into a lot of detail, but showed the reasons why the project was failing. And two of the main reasons were that the communication around nutritional practice was to the mother, whereas in traditional Bangladeshi households, a mother-in-law plays an important role, as do the husbands, and there was no communication to them around the program and the importance of listening to the messages the mother was receiving around nutrition. And the second was bad targeting of the program, because the community nutrition practitioners were unable to read the growth charts, so they didn't know which children should be entered into the program and which ones shouldn't. I mentioned that because partly because so what we did was combined a process evaluation with an impact evaluation. And had we just done a process evaluation then and said, oh, but there's, the program's got problems in targeting, would have been told by the program staff, but look what's happening, we've eliminated severe malnutrition. But because we did an impact evaluation, we could say, no, actually you haven't. There's no difference in malnutrition in program areas and comparable non-program areas. So it's the combination of the two in a mixed method evaluation that really allows you to give powerful messages, not just about is it working or not, but about program design features, failure to include mother-in-laws and husbands, failure to train the TNPS properly, that give you information about program design as well. And I'm going to say this a couple of times. There's been a rise in doing rigorous impact evaluations, which is a good thing. Prior to that, we were only doing qualitative evaluations. So it's not that suddenly, oh, we think only quantitative evaluation, eventual evaluation in town. We've always done qualitative evaluations. They've always been there, and they have a particular role, but their failure to be able to answer specific questions is a reason why we need impact evaluation as well. So I think we actually all agree to the mantra, you use the appropriate research design for the appropriate question. And there are certain research questions or evaluation questions for which quantitative impact evaluations are the right design. There are other questions for which they're not the right design. So I speak about the evidence revolution that's been through 4 waves, of which new public management in the 1990s was the first wave. But the second wave has been the rise of impact evaluation, and the third wave is the rise of systematic reviews. And this is a graph for impact evaluations on international development. So these are programs in developing countries supported by both NGOs and international development agencies. And these data come from the 3i database. So 3i is the International Initiative for Impact Evaluation. It's a global grant-making body that I set up about, how long ago now? 12, 13 years ago now, in my previous job before Campbell. And so on the 3i website, there's a database of all impact evaluations, and you see the number has grown very rapidly since the early 2000s. And also the number of systematic reviews has grown, though according to the 3i database has stalled more in recent years. These systematic reviews are mainly effectiveness reviews, so it means they are reviews of impact evaluations. But systematic reviewing is just a research approach that seeks to overcome the biases in traditional literature reviews. Now, as a research approach, it can be applied to any research question, any research literature. So you can, and people do systematic reviews of qualitative literature. You do systematic reviews of process evaluations. We normally do mixed method systematic reviews, which include both the quantitative effectiveness studies and the qualitative process evaluation studies in the same review. And so to say, oh, systematic reviews are sort of particular type of evidence, that's not true. It's just a research approach. It's like saying adding up is a particular. I think adding up might be a particular research approach, but it's a general approach that can be applied to any research question. Though historically it has been mainly applied to effectiveness reviews. Cochrane, which drove a lot of the early evidence-based medicine, as Hugh mentioned, has done only effectiveness reviews to date. It's starting to do qualitative reviews, and the same is true of Campbell, though we have been publishing mixed method reviews for at least 10 years now. There's also been part of the evidence revolution is the rise of evidence legislating for evidence. So the Evidence Act of the US a couple of years ago, the social impact law in Mexico from nearly 20 years ago now, which required all government-funded social programs in Mexico to have impact evaluations and M&E frameworks approved by CONEVAL, the Central Evaluation Agency, and the rise of evidence-based budgeting, particularly in the United States, where programs can only get, so here's $500 million for child protection programs. You have to have an evidence-based program to be eligible for this funding. So these are things, part of the evidence revolution that's driving the use towards use of evidence. And what I'm going to speak about in more detail is the what works movement. So the what works movement, like new public management, is largely an Anglo-Saxon phenomenon. You find it mostly in the US, UK, Australia, a bit in New Zealand, much less so in European countries. So there are bits of exceptions, particularly Nordic countries. There's what I call the Nordic model, which is different to the What Works model, but is this also an institutionalization of use of evidence, which is what the What Works movement seeks to play. And the What Works movement, the What Works centers play several different roles. They're funders of studies and of primary studies and of reviews, but their main role is a knowledge broker. And Hugh mentioned knowledge brokers. And so knowledge brokers are people who take the research evidence and put it in a form that's more accessible to intended users, policymakers, practitioners, decision makers, and so on. And so we've always done that. We've always known that, oh, you have to write a policy brief, but what you actually need to do is so much more. And what the What Works centers are doing, I'm going to show examples in a minute, is there so much more. So here's an example, we'll see a more detailed example in a second, of what I call an evidence portal from the Education Endowment Fund, which is one foundation, which is one of the largest What Works centers. And they provide evidence based on how to improve learning outcomes for disadvantaged children in schools in England, based on evidence from systematic reviews. And the key thing here is that the evidence in these What Works centers comes from systematic reviews. So I'm going to come back to that. So first I want to address the question that I was partly asked to address, which is, what does this mean for you, the audience? Or should you be a producer or user evidence, or should you be both? And it just so happens a couple of weeks ago, a woman called Caroline Fines, who runs a group called Giving Evidence in the UK, posted a blog saying that many charities are too small to measure their own impact. So Caroline was arguing in this blog, the link is on the slide, that most of you shouldn't actually be going to carry out your own impact evaluation. This means impact evaluation. This shouldn't mean you shouldn't do other types of evaluation, but you shouldn't be trying to do impact evaluations or make claims about impact in the absence of such interventions. Caroline's a strong believer in rigorous impact evaluations using comparison groups. And so you can't, a lot of NGOs use impact stories where they go and meet a person, that's a girl that's given a bicycle, and so she's empowered because she can go to school. They tell a story about that girl and have a nice photo of that girl. That's an impact story. It's just not of any meaning, any use whatsoever in terms of understanding the impact of that organization. By impact, I'm meaning proper impact evaluations of the sort I mentioned at the beginning. So Caroline says you shouldn't be doing this because you've got the wrong incentives. So we all have an incentive to paint ourselves in a good light. And so if you're doing your own evaluations, you want to paint yourself in a good light. And so she cites a randomized controlled trial carried out by a group called IPA, who offered charities the chance to do an impact evaluation. And different charities were given different information. Some were told, oh, we've done similar studies in your sector before and they find a negative impact. And others were told, oh, I've done similar studies in your sector before and they find a positive impact. And those that were told they find a negative impact didn't want an impact evaluation. So when they were told they found a positive impact, they were more inclined to say, okay, let's do one of those studies. So people want to present themselves in a good light. Second is that you lack the skills. So impact evaluation is a specialized research method, and so you don't have those skills. You would need to commission researchers to do that work for you, and that comes with a whole set of additional issues. They're relatively expensive compared to a process evaluation. An impact evaluation costs a lot more money, and so people don't have the funding to do it, and you're too small. Impact evaluations require a certain sample size to be able to do the calculations that are needed, and if you don't operate on that scale, you simply can't do that. So what Caroline says is the people at this conference should be a user of evidence, but not a producer. I would put an important caveat around that. So about 10 years ago, it's when I was working at 3IE, whose main office is in Delhi. I was asked by the US NGO umbrella body Interaction, which is an umbrella body for development-oriented NGOs in the US, to do a presentation at their annual conference, rather like this one. And there was a strong debate going on at that time about whether NGOs should do impact evaluation, measure impact, and many of the NGOs were saying, oh, it's not possible to measure impact in our sector, we're too nebulous and our outcomes aren't clearly defined and so on, so we shouldn't try to speak about impact in our sector, we shouldn't try and do any sort of reporting around our impact. And I was due to make this presentation. As I mentioned, our office is in Delhi. For 3I, the main office of 3I is in Delhi, and it so happened that our tea lady in the office has her own NGO, a woman called Clara. She ran her own NGO. Her and her husbands and friends used to go around houses in middle-class areas, collect donations of clothes and money, and they'd mostly sell the clothes, and they raised money to hire a doctor and a nurse to go into immunization programs in the slum areas near where they lived in Delhi. And their annual budget was $7,000 a year. So they raised this money and they got $7,000. So it's a really small NGO doing immunization in a couple of slum areas. And I went and visited her office and the work they were doing. And she presented me her results document, which was basically a list of all the people they'd immunized, all the money they'd raised, and how many people they'd immunized each month. And so it was basic results reporting in terms of here's what we've done. This is an NGO with a budget of $7,000 a year, so nothing as most of us are concerned, and they're still doing some sort of monitoring and reporting. So we should, all of us, be doing some sort of monitoring and reporting. At a very basic level, you should be monitoring what you're doing, and that applies to monitoring and applies to evaluation. A lot of what I do, and I've done over the last 40 years now, is looking at evaluations. And what amazes me is forget about the counterfactual, is how weak the factual is in many evaluations. They simply don't describe what was being done. So when I was at the World Bank in the evaluation department, we used to review all the implementation completion reports, at the end line evaluations done by, process evaluations done by the operational side of the bank. And I would just sit there thinking, you spent $300 million on this program. What did you spend it on? And the evaluation simply wouldn't say, well, we spent the $300 million on this, this, and this. So just getting a factual statement in your process evaluations is very important. And a lot of this through monitoring can be done in real time. Monitoring is not just numbers. Monitoring, and particularly real-time evaluation, includes also qualitative data feedback through various means. So commonly, it's a common thing I write about, many programs fail to reach their intended audience, or at least don't reach the numbers they expect. So we target 1,000 people, but in the end, you'll probably reach 20% of those people that you plan to target. Why? What are what we call the main barriers and facilitators to people taking part in the program? You can understand that in real time with formative evaluation. So you should be doing that. And then some NGOs can do impact evaluation. So the main research organizations doing impact evaluations like JPAL, IPA, and so on, they work with NGOs. So a lot of JPAL's work in India is done with a education NGO called Pratham, for example. The famous deworming study in Kenya was done with an NGO. NGOs are much more flexible than governments are. It's very hard to get an impact evaluation agreed with a government. If you're a big official donor like the World Bank, we could do it. But if you're a small researcher, you haven't got the leverage to get a government to do an impact evaluation of its program. You probably can get an NGO to do an impact evaluation of its program. So some NGOs are working on sufficient scale and are involved in impact evaluations. So I don't entirely agree with Caroline. I agree many NGOs shouldn't be doing this, but you should still be thinking about what M&E should we be doing. Now that's talking about production. Now let's come on to using evidence. Here I'm talking very much about the supply side. This pyramid here is from a paper I published in Nature a couple of years ago. In that paper, I talk also about the demand side. So the demand side is equally important. Hugh stressed this, and I agree entirely. The demand side is important. I'm just not talking about it here. In this evidence pyramid, this is not a hierarchy. Pyramids are not hierarchies. There is an evidence pyramid of RCTs and reviews at the top, which is a hierarchy, but in general, pyramids are pyramids, they're not hierarchies, yes? And so the idea of this pyramid is not that checklists and guidelines are better than the stuff below it. The idea of the pyramid is the stuff at the top is supported by the stuff below it. So you can only build the top of the pyramid if you have the base of the pyramid. And that's an important point to bear in mind. But I'm not going to go through the detail in this pyramid in detail. The key point is that the top of the pyramid has evidence portals or toolkits, I'll talk a bit more about in a moment. And it has guidelines on guidance on how to do certain things, and it has checklists on what you should do. These are evidence products that differ in their purpose. So evidence portals are what Hugh was talking about. They say, what works? What should you do? They don't tell you what to do. They say, here's the evidence on 20 different interventions to improve learning outcomes for children. Here's the evidence on if they work or not. So you pick one, and I'll show you an example in a minute. So there's like, what works? Here's the evidence, you pick. Guidance is more about how to do it. It's not what to do. There can be a bit about what to do, but they're much more about how to do it. And they're guidance. You know, it's like, well, we've looked at the evidence. Here's what an expert group think you should do based on the evidence. You're doing intervention in this area, but it's guidance. You know, do it if you want to. And finally, there are checklists, which are much more about implementation, and it's just do this. So it would be, so let's just think of a review we did on farmer field schools, which are sort of agricultural extension programs. So the common reason for barriers why people didn't take part were the training was done at the wrong time, wrong place to be convenient for the target group. That you had facilitators that couldn't speak the local language, that you had facilitators who weren't trained in participatory methods that are required for this type of approach, that you had used male extension workers to work with all female farmer groups, which in some places just doesn't work, and so on. So a checklist would contain items like that to ensure you are designing the program correctly. So checklists inform both design and implementation of programs based on the evidence. So all these are called evidence-based decision-making products, and they allow decision makers, people like you, to make decisions based on the evidence without having to go and look at the evidence. So if you go and look at an evidence portal or toolkit, you can make a decision. Okay, what programs am I going to do? Based on evidence from systematic reviews. So when I talked about the Teaching and Learning Toolkit from the Education Endowment Foundation, a study by the UK National Audit Office carried out in 2015 found that 63%, so nearly 2/3 of schools in England were using the toolkit in deciding how to allocate school resources and what to do in the classroom. So 2/3 of schools in England are using evidence from systematic reviews, because the toolkit's based on systematic reviews. But the teachers, the head teachers and so on, the school managers making those decisions probably don't know what a systematic review is. They don't need to, because the toolkit is based on systematic reviews and tells them what they need to know. And we're going to see an example of that right now. So here's another toolkit from Youth Endowment Fund on youth offending. So these are different approaches that you might use to reduce youth offending. YEF buys very strongly into preventive model. So you try and prevent aggressive and disruptive behavior in early years to stop children later on becoming offenders during their adolescence. There's a lot of what's in the toolkit is around, say, after-school programs, anti-bullying programs, which are preventive programs. And as you see, the toolkit it lists different approaches. I think there are a dozen approaches in the first edition of the YEF toolkit, which might be used to address disruptive and offending behavior amongst children. And it gives 3 metrics. One is the cost, are these high or low cost interventions? Second, how good is the evidence in which we're basing this decision? And finally, do these have a positive impact? And the impact is low for the first couple, and boot camps are actually harmful. This is what we call the top level of the toolkit. You can click on any intervention, say anti-bullying, or actually we've clicked on CBT here. So you click on cognitive behavioral therapy, and then you get the second level, which describes what the intervention is, and it talks about the implementation evidence. It talks about moderators. So Hugh had stressed a lot about you can't assume one thing that worked in one place works in another place for another group of people. No one thinks that. We think that you need to look at the evidence, preferably the whole body of evidence, and try and work out what works for who and where under what circumstances. And that's what the second level of the toolkit tries to unpack, that question about what works, who for where, under what circumstances. This second level is based on a technical report, which we're working with YEF, Campbell Collaboration. We're working with YEF to draft these technical reports, which are the basis for the approaches in the toolkit and the text in the toolkit. And these technical reports are based on systematic reviews. So for each technical report, we pick what we think is the most appropriate review to inform that toolkit, that technical report. We write a technical report and then develop the ratings to go into the toolkit. So this toolkit that sits up there, and there are many of them now across different what work centers: education, local economic development, offending, homelessness. We're working one on youth employment and so on. So all of these evidence products at the top of the pyramid are based on systematic reviews. There's also guidance. So here are guidance reports from the Education Endowment Foundation. These are much more, as I said earlier, about how to do it rather than what to do. And these are also based on systematic reviews. So as Hugh also mentioned, evidence-based medicine really drove the evidence movement. Evidence-based medicine, medicine-based health is far above the other sectors so far. And WHO have a guidelines on guidelines, basically what's called the Handbook of Guidelines Development. And in the guidelines on guidelines, it says WHO guidelines have to be based on high quality systematic reviews. It's there. This is how you do a guidance. You base it on systematic reviews. You do not base it on expert opinion. That's the old approach. So back 20 years ago, WHO did guidance based on expert opinion. Many UN bodies still do guidance based on expert opinion. It's not the way to do it. You take into account evidence from systematic reviews, expert opinion, and values. So values come in terms of what's nationally appropriate in your setting, to think about how you interpret the evidence to apply it in your setting. So values come into the evidence-based model in a way that Hugh was referring to. So where can you find the evidence? So you need to hire knowledge brokers. So knowledge brokering it's a fourth wave of the evidence revolution, is knowledge brokering. The What Works movement is part of the fourth wave. But in your own organization, you need to hire knowledge brokers to help navigate the evidence. Someone who knows where these different evidence portals are, who can help you interpret the evidence, or who can read a review and help you interpret the review and knows how to find the reviews. You can't expect program managers to have this skill set. You can't expect program managers to know where to find the evidence portals or their guidance and actually know how to use them. You need someone whose job it is to do that, an intermediary in your organization between the decision makers, the program managers, and the evidence. You need that intermediary role. You can use existing toolkits and guidance. There's one for homelessness is shown there, which is based on various systematic reviews, but you can also consult the reviews directly. So there's we've just had a review come out on multisystemic therapy. There's an older one, another new one also on aquaculture. So you can consult the existing reviews if there aren't toolkits and guidance available. Evidence and gap maps I haven't mentioned. Evidence and gap maps are a great product with interactive guide to the evidence. Normally they contain both this is a map for effectiveness studies. We're currently adding process evaluations to this map. It's for youth employment. So youth futures about youth employment. And they're interactive. So they structure the evidence in a navigable way, an accessible way, and you can click on any cell and get a list of all the studies in that cell and a summary of each study, which appears in the right-hand panel. And from the summary, you can actually click to get to the study itself. So evidence and gap maps are a great way of knowing what the evidence is for a particular sector, and you can find the reviews for that sector from evidence and gap map. Campbell produces a growing number of maps, we've got 30 or so now in production, so you can find them in the Campbell Systematic Reviews Journal. 3IE produces many maps on the 3i website and also in the 3i database. So there are various ways to find the reviews and the maps. So there's 3i Development Evidence Portal, the database I mentioned earlier that I used to do the graphs I showed you earlier. 3i has evidence and gap maps and so on, but there's also Epistemonicus. Epistemonicus is for health specifically. There's ERIC, which is for education. There are others, so like there's EGAP for governance. There's the Global Policing Database for policing and so on. So a number of these these evidence resources. There's a homelessness hub in Canada, but there's also the 2 evidence gap maps we've done on homelessness with the Centre for Homeless Impact in the UK. So there's lots of different resources out there that contain evidence for a particular sector. They're the evidence platforms that are in my pyramid. But they do take you back to the research evidence, whereas the toolkits allow you to make decisions about how looking at the evidence. These resources take you back to the evidence. Or you can go directly to the collections. So these are thematic collections of evidence for international development or health or education and so on. These are particular bodies who produce systematic reviews. So the role of Cochrane, the role of Campbell, the role of Collaboration for Environmental Evidence, and there are a few others I haven't put on the slide here, but these are the main ones, produce systematic reviews and evidence maps. That's our job. So if you look at the pyramid there, we have a particular row in that pyramid doing maps and reviews. That's where we come in. But as someone who is an advocate for using evidence, I work a lot in the upper end of the pyramid as well in helping agencies develop guidance and toolkits and so on, and commissioning and producing reviews that inform those products. But you can go and look at the prime studies yourself. And it's not in this presentation, but I use the Cochrane Library myself a lot. I have a bad knee. I had a knee operation a few years ago, and I get recommended lots of exercises after my operation. They don't do any good. They're useless. The Cochrane review showing these exercises are no good whatsoever. So don't do them. I have osteoarthritis in both knees, quite bad. Turmeric, really good. A systematic review showing turmeric is really good for pain relief, as good as paracetamol. So I have a lot of turmeric. It's a good anti-inflammatory. So I use systematic reviews in my daily living. And if I can use systematic reviews in my daily living, I think you should certainly be using systematic reviews in how you inform policy and practice in your particular programs. And so I have finished, I think. They're all searchable. So all of these resources are searchable. So you can go there and you can search. I search here on aging, older aging. Here's a series of reviews that come up if you do that search. And every review we have, every Cochrane review has a plain language summary that tells you in plain language what the review findings are. And so there you go. This is all part of the evidence revolution. It's up there, it's happening. The evidence is out there and available. You should please be using it. So do join us. Thank you.
Thank you, Howard. So instead of watching some YouTuber telling you what to do in your life, we should all read systematic reviews. Next, we have Mrs. Anita Lolim. And maybe you can share with us whether you access some of these evidence and read systematic reviews as you develop some of your programs. To Anita, please.
Thank you, Justin. Good morning to all. My name is Anita and I am a Senior Director in Touch Community Services. I oversee the Impact and Research team, and thank you for allowing us to share our story and our journey in using evidence in programs and practices in Touch. The starting point for Touch to venture into the research field was really through one of our flagship programs called Touch Cyber Wellness, or TCW. TCW was established 20 years ago, and at that time, we didn't know about needs assessment, pilot runs, theoretical framing. All these things was not known to us. We just knew that excessive gaming and excessive internet use would pose a real risk to our young people, and we wanted to do something about it. So we had a concept, we implemented the concept, and it thankfully reaped very positive response in the community. We wanted to find out if this program was indeed useful or effective for our community. And at that time, there was a team of researchers who were very eager to learn about our program and how we were working with the youth with excessive gaming habits. So that was about 2010. And Touch Cyber Wellness was formed in 2001. So by 2010, we are about 10 years old and relatively successful. I remember having a conversation with Dr. Timothy Sim, who was the researcher for this paper. And we were talking about how we should look at the program and how we should study the effectiveness of this program. And he asked me a question that I thought was almost life-changing. He asked me, Touch Cyber Wellness is already known for what you're doing and you're doing relatively well. Why do you want to be so hard on yourself to show your vulnerability through an evaluation report? What about the risk? And I remember being taken aback by this question, and then I told him, if we are good and we are effective, then maybe we want to be able to show it. And that was how we got started on this paper and how we started a journey to build a theoretical framework around the work of touch cyber wellness, and how we interviewed participants, how we interviewed parents, how we interviewed the other community volunteers who were involved in our program, and then we wrote the report. And when the report was out in 2012, we learned about our strengths and our weaknesses of this program. And from this report, we learned that we had to increase our parental and family engagement in order for our program to be more effective. And so we did a revision of this program based on this report. And the second version of our intervention program on excessive gaming had an increased number in terms of parental session and engagement. And subsequently, we submitted this second version for an international award, and we won in this award held in Hong Kong. We won 2 awards. We won the Silver Award, and we won also the My Favorite Project Award. The second award for My Favorite Project was especially meaningful because it was voted by practitioners from the Asian region who participated in the conference. So this paper was really foundational in our adoption of a research mindset and using evidence in touch. So this slide illustrates for you the research milestones in touch. In 2012, I mentioned earlier, we were working on the cyber wellness report plus other smaller projects, but that was on the basis of commissioning a third person who was looking at our program. And by 2013, 2016, we were moving a lot into research collaborations with researchers who were interested in our work. Beyond the cyber wellness domain, we also had reports on our service learning training. And by 2016, we had a hunch that we had to introduce this capability into the organization in a more formal way. And so we made a pitch to our senior management, our CEO at the time, to formalize the research activity. And very thankful for the support of the management and the board of directors. The impact and research team as a research unit was formalized in 2017. And by 2018, 2019, 2020, we were in a flurry of activities to develop the impact and research framework for the organization. We were conducting in-house capability training. We published 2 papers, and by 2021, we produced our first in-house program evaluation report. And we started the impact and research team with 3 headcounts. By 2022, we would have 6 headcount in the team, and we estimate that the number of projects that we are currently managing is about 68, ranging from program design, development, program monitoring, evaluation, knowledge generation, and research collaborations. So for a small team of 6 people, it is quite a lot of projects that we are managing currently. In the next few minutes, I will share with you some examples of our projects which required us to produce evidence, work with researchers, and how they have impacted our programs and our practices. The first one that you see on the screen now is a project called Digitally Ready Family. For this particular project, we did the needs assessment in-house to inform the program design. So from the needs assessment and the pilot runs, we learned to refine this program so that it can be properly launched in 2022. For the needs assessment, we work with about 35 parents and 56 children. We interviewed them, and then we wanted to understand what they needed from a program that would help them to be digitally equipped and able so that they can navigate home-based learning, they can work from home, they can do simple online transactions. So some of the key info we found that shaped our program design included the preferred format. From the needs assessment, we knew and we realized that the vulnerable family preferred a face-to-face interaction and timely support. But because of COVID, we couldn't do 100% face-to-face program. We had to have some sessions face-to-face and some sessions online. But what we did was to include a feature called the Cyber Wellness Ambassador to provide the timely support to the family during the online session. And this ambassador is actually a corporate partner, a corporate volunteer who would be with the family over a period of 6 to 10 weeks to help them to navigate the lessons and help them to be familiar with the features online. So this preferred model of a hybrid model was something that we learned through the needs assessment. And then the needs assessment also told us the top 3 motivations for them to participate. This included improved self. They wanted to have family bonding and they participated because they wanted to find out more for interest. And this helped us to design more relevant content. So based on this finding, what we did was not just to teach them how to use Zoom for home-based learning, we also taught them how to do online shopping, how to search for information, and how to use Zoom to keep in touch with the families and relatives whom they have not met over the last 2 years. And the third finding that we found from the needs assessment is one of the top concern, which is excessive device use, leading to family conflicts. And this allows us to introduce cyber wellness education and parenting training in this program as part of a mediating factor for the vulnerable family. And so the needs assessment allows us to have a better understanding in pilot run 1 and pilot run 2. And this program will have its full run in 2022, supported by the President's Challenge. After the pilot runs, the next slide, please, Stella. Pilot run, the pilot run reached out to 40 families, and the outcome of these 2 pilot runs showed us that the families had increased competency to use digital skills, gained confidence to use digital skills, and reduced conflict over device use. And the secondary outcome was for the parents, where they gained a sense of personal development and greater sense of self-esteem. Being able to help the children during HPL was important for the parents. Next slide. So that was an example of how needs assessment and pilot runs help us to shape our program. This other example is one example where we did a developmental evaluation report with the Center for Evidence and Implementation, CEI. This report helped us to understand this program called SPARKS. This program SPARKS was initiated in 2019. It is an intervention program for children aged 9 to 12 years old who have been identified with behavioral issues and they come from very adverse circumstances. The program works with the children and their family to improve the children's self-management, family relationships, and school bonding. The developmental report was important because it is a new program and we wanted to better understand the processes, whether it is working, what was working, why, how to refine it, etc. So by 2022, the project will end and there will be a final evaluation report. When we embark on this evaluation report, the Touch Impact and Research team already has a higher level of skills, and we were working with CEI in a collaboration way, working as partners, not just being evaluated. And that has allowed our team of social workers and counselors direct access to a team of professionals, and that has accelerated their learning in the area of evidence, of producing evidence or using evidence, or even just learning how to articulate the objective and the purpose of the program. So this was a very important lesson for us in our journey, as we understood that the evaluation mustn't be done only at the end of the program, but it can be done as a developmental piece of work so that we can understand and refine along the way. And the last example is this report that we produce in-house by the Impact and Research team. This is an in-house evaluation report for a program called LEAD. LEAD stands for Leverage, Ideals, and Tools. This is a program to reduce at-risk behaviors among delinquent youths. And the reason why we're doing this in-house is because, number one, we had no money, we had very limited budget to do this evaluation. And by then we had increased in-house capability to do the scheme of research activities for this report. So we did the data collection, data analysis, we interviewed our staff, our colleagues, we interviewed the clients, we did the full scope. And this again allowed us to improve in terms of our ability to understand how our programs are doing and how we can also work alongside our direct service colleagues to help them to understand what they are doing as well. So the above three examples would be impossible to achieve if not for the fact that there was a very intentional plan to build capability in the organization. And since 2018, we intentionally work on building capability in-house. We were hoping and we were attempting and we are still trying to change the corporate DNA of Touch to include research and evidence use as a core identity. And so you all would agree that it is difficult to introduce something new in the organization. And what we're trying to do now is changing mindset, shift paradigm in the services and among our colleagues. So we conducted several in-house workshops, and in this workshop, we taught our colleagues how to do the theory of change, how to do logic model, and we encouraged them to bring along a project that they're working on so that we can work through the theory of change and logic model with them. So to date, about 1/3 of the organization has gone through the workshop, and this workshop is not the only thing that we do. We have regular coffee talk for smaller groups of people. And the staff can learn about how to do literature review, how to conduct needs assessment, how to do data analysis. And these are all tips and skills that we're hoping to impart to our colleagues in direct services. But more importantly, the capability building came from informal interaction with our staff on a very regular basis, where we meet them almost one-on-one to work through their projects. The slide that you're looking at now shows our Touch Family Conference that we organize. It's the inaugural Touch Family Conference. But the important thing about this slide is I want to highlight the involvement of our direct service colleagues. You see at the bottom two picture, you have June and Calvin Lee. They are colleagues who were previously may not be so involved in this piece of work. But because of the training that we have done in-house, because they have worked through with us their projects, we encourage them to take on this role as a moderator at the conference together with the speakers. And it was a stretch goal for them, but they were able to overcome their fear and they executed the moderation impressively. So it is important that we take everybody else in the organization along with us on this journey so that the whole organization can understand what we're trying to do. And the next slide. Many people also ask, so what are the benefits? Why do you want to do this thing? Why do you want to invest money hiring a team of people? I think the greatest benefit that we can attest to is clarity. Clarity for the people when we actually can articulate what we are doing through the theory of change and the logic model that we work on. So including staff, donors, volunteers, and even clients, they are clear about what they are doing, and clients know why we are involving them in the program because we share with them in very simple terms what we're trying to achieve. And this has allowed us to collaborate as a whole organization. And what has happened is a new thing that we did not expect, which is we are all speaking the same language now. So instead of asking what's the problem, we're all asking what's the problem statement. And with this new language, we have created a new culture in Touch, where the planning and the design of program is now based on theory of change and logic model and literature review, and interacting with our impact and research team, and also the other support function like the partnership team who helps us to raise funds for our program. And the second benefit that we observed is an increase in confidence in touch as an organization. It is very encouraging to see that across 21 services in touch, our colleagues, they were all experiencing favorable considerations as they presented their work in a more evidence-based, more evidence-informed manner. We could see that the funders or the institutions that we're engaging with can clearly understand our intention, and all this work towards the benefit of our clients because resources become more sustainable. So in summary, the success factors for touch includes a clear vision. The leadership support is important, leadership support by the board and the management, and the systems and processes must be in place to facilitate the work of impact and research, including the financial resources, including building capability. And thirdly, partnering with the academics, the universities, the researchers is crucial for our success because they are so willing to share knowledge and they are so willing to teach us on how to do this piece of work. And having a full team of impact and research staff is also important because these are people who are not doing this as a secondary portfolio. We are 100% committed to this portfolio, and that gives us a lot of attention and a lot of space to develop the portfolio further. Relationship building is so important in change management. When we introduced this piece of work in touch, we had to be very intentional to communicate and to build trust and to have research advocates among the direct service colleagues so that they know that this piece of work, when done well and done properly, will benefit the client. And this was a piece of communication that we had to work on a very long-term basis. And finally, the external changing landscape for research and evidence use in social intervention helped propel our activity. And it is almost like being there at the right time, and the external environment kind of encouraged the activity to take place in the organization. So these success factors are crucial for touch in our context, and I'm sure in other agencies it will be different. You will have your own challenges, you will have your own advantages set of situations. And finally, the story that we have ends with this slide. It is really winning the colleagues over one by one. There will be people who ask you why I must change. There will be people who don't want to change. There will be people who don't understand why this is happening. But we believe that working with them one by one service at a time, one colleague at a time, is very important in implementing or in introducing and managing what is going to happen. And so this is something that we value a lot, the trust and the relationship in the organization. Without it, I don't think we can come this far in terms of our impact and research activity, but we credit our colleagues for giving us their support and being able to just journey with us, taking care of the clients one by one. So with that, I end my presentation. Thank you.
Thank you, Anita. So now that we've heard from Hugh about the evidence landscape, and then we've kind of heard from Howard the supply side of it, and from Anita Loh the demand side of it. So I would like to invite Chi Ming, maybe you could share with us first on maybe from your or ICS's point of view, if you were a non-profit in Singapore, should they be thinking about hiring researchers to produce research, or hiring actually knowledge brokers to kind of make sense of the research and learn how to use it? Over to you, Chi Ming.
Yeah, thanks, Justin. I think let me go through. I have some points. Let me go through that. Then maybe I think your question is thought-provoking, and I think it needs to be contextualized as well, given that I think many organizations, they have various capability and resources, right? And so thanks also to IPS and Toolkit for inviting me as a discussant of this panel, and thank you to the panelists for their sharings. As I mentioned, non-profit organizations come in varying sizes, and they're also at different stages when it comes to research and evaluation. Hence, perspectives and takeaways from today's panel can actually be quite different, and I would imagine, and needs to be contextualized, as I said. But despite this, I think we are here because we are united by a common desire to better understand the difference that we are making in the lives of our service users and how we might serve them better. I think conferences like these play a really important role, in my opinion, in terms of catalyzing discussions on how we might do this. Hugh started off by bringing us through the nuance shift from evidence-based to evidence-informed. I think that's important. And the complexity of integrating knowledge and practice. Howard then continued by explaining that the evidence revolution. I think that was really intriguing. Yeah, the need to account for the counterfactual and the consideration being a producer and user of evidence. And finally, Anita shared touches an encouraging journey in terms of embedding the use of data and evidence within the organization. And importantly, how we can grow a culture using evidence. Yeah. So reflecting on these presentations, I'd like to just share briefly on 3 points. I think the first, I think it's very clear from this presentation, evidence and practice must go hand in hand. And we must commit to using evidence in our practice. Practice wisdom is useful, but it also needs research and evidence to go along with it, right? In order to make progress in what we do in the social, in the non-profit as well as social service sector. At NCSS, we did some survey a while ago, and currently 8 in 10 social service agencies that we have surveyed in 2021 indicated a desire to strengthen their research and evaluation capabilities in the next 1-2 years. However, the top 3 challenges that they face were 1, manpower constraint. So Justin, we talk about, needing to contextualize. So we have big agencies, we're smaller ones who might find, the latter might find doing research and evaluation a lot more difficult. 2, insufficient financial resources, and 3, limited knowledge and the know-how how to conduct research and evaluation. So these are real issues. But I think the commitment must be there. I think Anita showed us how Touch began their journey. I think, and how far they have come since then. A journey of 1,000 miles start with a single step. I think Anita would agree with this, and the commitment that Touch displayed, I think, is exemplary. Yeah. And that brings me to the second point. Thinking big, but starting small. Right, we have a vision. The vision is to use evidence to improve our practice. But it is a tall order if you think about it in terms of quantum leap. Making the big jump, will I fall halfway through that jump, and where will I land? Right. Maybe then it's useful to structure this in terms of many small jumps, right, or many small steps that we could take. Right. And when it comes to questions of impact measurement and thinking about whether evidence is good enough or what evidence is good enough. One common feeling that we encountered, and including myself, is the feeling of being overwhelmed, right? Maybe inadequate or not knowing where to start, right? Similarly, after listening to the panelists today, many of us among us here might also have big ideas on how they could transform their agency, but might not be sure how to begin. Right? Such feelings are not uncommon. I find myself feeling similar at times in the past, now too, as well as we embark on various projects and looking at various evaluations. But what I found useful is really to come back to this simple principle. Yeah, think big, but we start small, right? Be agile. Yeah, so for example, you could start thinking about ways you can move from collecting data on the number of beneficiaries served on data and how on their about their behavior, knowledge, attitudes might have changed. And starting out, this could even be done through relatively, pre-post test design, and the professors amongst us here might disagree, but it's about starting small, I believe, as opposed to implementing RCTs right off the bat, right? So think about your own context, right? The resources you have, and commit to that, taking the first step, right? To paraphrase a line that Howard shared earlier, collecting the evidence appropriate to your skill and your needs. I think the takeaway for me at least is don't let perfect be the enemy of good. Let's start somewhere, yeah, where we're comfortable with it. But commit to the bigger sort of frame whereby we want to use evidence, right? And we want to be there eventually somewhere, right? Commit to that. And my last point is that you're not alone in this journey. Again, Hugh and Anita made an excellent point of fostering partnerships and collaborations. These are key. how can we come together, right, to share resources, to collaborate, to take advantage of common infrastructure. We're in the non-profit sector, we're in the social service sector. I think what we want to do here is to do good for the people we serve. Can we help each other, right, to get on this journey, right, to walk this journey together? NCSS is always keen to help our members, for one, in their research and evaluation journey. And here I offer, and we offer a range of enabling resources from repositories of local research, and this is new, to free access to scholarly journals, online courses in research ethics, etc. And we also plan to introduce volunteer research practice scheme to help our members. Those amongst us who are members of NCSS, please take advantage of this. This is one way of us contributing to this landscape. We have also recently announced the sector evaluation framework, which aims to provide organizations and funders in the social service sector with a common language to frame and evaluate outcomes. And again, I invite those who are interested to get in touch with us to exchange ideas. Right, to end off, and to reiterate my 3 points, I think first, really, can we commit to using evidence in our practice, commit to the larger vision, right? How we can use evidence to improve what we do and how we do things. And 2, think big, but start small, right? Think of the ways that you can start evaluating your own programs today, and don't be afraid to approach others whom already might have good experience, right, to explore partnerships and collaboration. And if NCSS could be of any help, do contact myself or my team, and together we can make a difference in using data evidence to better our practices. Thank you.
Thank you, Jiming. Over to you, Helen.
Okay. Hello, hi everyone, and thank you, Justin, for the invite to be discussants for this panel. All right, I really enjoyed the presentations as well, and some of the points that the speakers shared really resonated with me. So I will start off with what Hugh shared, and he mentioned about how knowledge for effective services is much broader than simply what works, and it includes things such as the complex nature of social problems, understanding what worked well to resolve what part of the problem in what kind of context. He also mentioned about the need to support implementation of the proposed solution and knowing who we should involve. And I agree that these are important aspects to consider, because practitioners, when we do talk to them, they want these answers as well, like when they're designing their programs, how do I know what works, and it's not just about that the program has worked. So I want to add that because of the complex nature of social problems, sometimes resolving a social issue using an approach A could create consequence B and then consequence C over time. So for example, we want to allow persons who are visually impaired to leave their house and to move around their neighborhoods independently. So we want to design an environment that allows them to move around with ease. And placing tactiles on walkways is useful because it allows them to navigate using their cane. So this is considered a good solution to address this problem. However, placing tactiles on walkways could make it difficult for residents on wheel and pushchairs to move around. And this could discourage them from leaving their house, which increases their risk of social isolation. It is therefore not enough for me as a practitioner to know how well a solution works in terms of the problem that it is trying to address, but also the repercussions of the solutions on other stakeholders in the community. So hence the ensuring the diversity of stakeholders in the solutioning process becomes important. Taking into account what they say allows us to make decisions knowing what could happen when we implement or we select a particular course of action. And I also agree with you as well that we need to be highly aware of the power dynamics in the stakeholders in the process of using evidence, because I've seen it happen quite a few times when what is considered good evidence may not exactly be good evidence, but it's because somebody else said so. I find the resources shared by Howard useful. Evidence synthesis do save us quite a bit of time, and we really appreciate it when we have them. So the use of the simple language as well, it's quite useful for practitioners because they do struggle with some of the jargons that's a bit more technical. So I want to thank you for making available these resources. And monitoring reporting is also important because it allows us to know what's going on quite quickly when a program is being implemented. So we could take actions to fix stuff when something is off track. So the challenge for us is how we could collate some of these indicators without creating more admin burden for my practitioners. And I totally resonate with what Anita shared, especially on the importance of engaging stakeholders in this journey. Yeah, I really resonate with that, especially when we want to encourage the use of evidence to inform practice and planning. And I agree with Chiming that it's one small step at a time. So what we noticed, what we found helpful was that by working with the friendlier teams who are ready for change in the agency, and that allows them to share with others on their team that, hey, you know, I found this thing really useful. You may want to consider working with the research units to look at this part of what you're doing. And another aspect that was important for us on our journey was leadership that invest. So it's not just saying that, hey, you know, it's important to use evidence to inform what we do, but they really invest in resources. And because of the resources invested, we could work with the Social Service Research Center to start off a capability development program. So if you're interested in their capability development program, you can speak to Robin. She spoke yesterday as a discussant. And we also have academics from different institutions on our ethics advisory committee because we didn't really have access to IRB when we first started out. So what we did was we actually approached some academics from different institutions and we put together an ethics advisory committee. So that was useful in guiding what we are doing. And some of them also sat on our board. And as part of giving back to the community, what we do is that we share with our journey with them quite openly. The struggles we face, the resource that we need to start things off. And the one thing that we encountered that was really a challenge is ensuring our staff that it's okay to fail. And that failures are part of learning because it tells us what we need to do better. So it requires a shift in the larger environment, which will take some time for us to make it happen. And for example, addressing how staff are being appraised and reducing the focus on meeting funders' KPIs. Not that they're not important, you still need to meet those KPIs, but maybe we need to look at something else as well. Finally, I want to share also that besides being interested to know what works, I'm also interested to know what didn't work, for whom and why, because these are important learning points in the journey in programming. So we need to know what failed and why those things fail so we can help our other colleagues who are doing something similar, learn from those mistakes, and we don't have to make those mistakes again, if possible. And I also wanted to talk about how sometimes we don't really need a research to tell us that a problem exists. So just by having a resident share with us that, you know, I'm facing this in my context because of what you did, this solution, that brilliant idea that you came up with, I think that's enough. That's good enough evidence for me that this problem exists and we need to close the gap. So I don't need 10 of residents to tell me that problem exists, because that problem really exists for this person in that context. And I think we need to take that seriously. Finally, I want to share about how we need to include residents in our conversations, because I think they're the missing piece and they are the main stakeholders. So how much say do they have in the use of their data to inform programming? And how do they experience our data gathering processes? I know we're really keen to use evidence, but maybe we need to look at how they're experiencing this data collecting process that we do frequently. For example, a resident with marital issues who finally plucked up the courage to seek help at the nearest FSC. What is it like for her when she's being asked to complete a 35 items pre-test as part of a study to enhance marriage counseling services? So what does that mean for her? Is she how does she see it, you know, when somebody speaks to her about it? So yeah, so I think there's a need to balance the need for evidence to inform practice while taking into account residents' rights, experiences of services, and to make sure that those things are not compromised. So yeah, so these are some of my thoughts.
Thank you so much, Helen. It would have been really nice to have a dialogue now between the panelists, but we've eaten into the breakout sessions. So I would like to invite everyone to go to the breakout sessions, ask your questions there, and then we'll come back maybe 5 minutes before 12 so that all the panelists can have a chance to sum up and reflect on what each other has said. So if you click on the breakout rooms, you can choose a breakout room to go into at the bottom of your Zoom screen. Hi everyone, thanks for sticking with us, and we've come to the end of the panel discussion. I'm so sorry we didn't have that much time for a breakout dialogue, but I want to give an opportunity to all the speakers, panelists, to give us some reflections from today's discussion. Maybe Hugh, would you like to go first?
Thank you, Justin. Yes, I think the main observation I'd make from the breakout discussions we had is that there is a real interest and appetite for building more partnership ways and more integrated ways of working between researcher expertise and practitioner and service delivery expertise, and that there are a plethora of different models that are available for doing that. There's a lot of innovation around the globe on different ways of building researcher practice partnerships, or from working with academic partners through building research networks, through employing knowledge brokers, to embedding researchers within the service delivery organization. And I think that range of models that are available gives NGOs some significant challenges about choosing which model is going to work for them best. And I think it is about trying to look and see what's out there, and then develop something that fits the local circumstances.
Thank you, Hugh. Helen, would you like to go?
Sure. My own reflection is that partners are really important in this journey. And so for the teams who wants to start off something in-house, I think those of us who have a bit more, we will be happy to share with you what it took for us to get where we are. And we still have a long journey ahead of us. And I think partnerships, when we work together to collect data, would help us save quite a bit of time if our research agenda is aligned. So you are not alone in this sector, and there's also communities of practice that you could tap on.
Thank you, Helen. Anita had to rush off, but Stella, her colleague, is here with us. Stella, would you like to share some reflections, closing reflections?
Reflections about the whole session?
Yeah.
I thought it's very encouraging to hear from different speakers, but we are all sort of saying similar things, and how we need to collaborate and how we need to build that relationship, especially for organizations starting to form a research unit. I thought it's encouraging because this is where the sector is moving, and just as Chi Ming has shared, even NCSS is on board to build resources, and I thought it is exciting to see how the social service sector will move in the next few years. Yeah.
Thank you. I think is Howard here already, or is still in his breakout room?
Yeah, I'm here.
Hi, Howard. You have the last word.
Oh, really?
Yes.
So I think what I concluded on behalf of everyone is that we need to organize. Something I hadn't mentioned is something called the 80% rule, which is 80% of the programs actually are ineffective when they're evaluated using rigorous impact evaluation methods. So most things your people do to improve people's lives actually don't work. And so that does mean, in the absence of referring to the evidence, you're likely doing programs that are ineffective. So it is a need to both use evidence to inform what programs you do, and to gather evidence on the effectiveness of your programs. That we discussed the need to therefore change the culture of evidence organizations to be more evidence oriented. And this was mentioned by another speaker, that you need to accept failure, because things don't work until you want to learn from failure. So a nice aphorism is that you should not penalize failure, you should penalize the failure to learn from failure. And so the leadership of organizations need to incorporate that into their management of the organization, into their performance appraisal of individuals. It won't be what did you achieve this year, it'll be what did you learn this year. And so we can go forward and think, let's make organizations to learning organizations. So I said it in the breakout group that it's 10 years since M&E became ME&L, monitoring, evaluation, and learning, but the L is often silent in many organizations. So we pay lip service to learning, but actually the actual learning of what was learned and what was done with that learning still remains limited. So I would urge everyone to go away from this session thinking, okay, I'm going to go out and I'm going to learn something that can make my organization more effective.
Thank you so much, Howard. And with that, we conclude today's panel discussion. Please come back at 3. So let's give a round of virtual applause to Hugh, Howard, Anita, Chimeng, Helen, and Stella. And if you have just a few seconds left, you can please fill in the feedback form, because it's also important to evaluate the panel and the conference itself. And we do plan to have a poll open throughout November. And so we're soliciting for your inputs on the kind of questions and opinions you might have about the use of evidence or evaluation. And so with those inputs, then we will open a poll in November, and that will feed into the policy paper we write at the end of the conference. So thank you so much, and see you later if you're going for panel 3 at 3 o'clock. Bye, everyone.